What is Medicare and Medicaid by Stephanie and Mary. Medicare is the federal health insurance program that pays for a variety of healthcare expenses. It's administered by the Centers for Medicare and Medicaid Services, which is a division of the U.S. Department of Health and Human Services. Medicare is an entitlement program, so most U.S. citizens earn the right to enroll in Medicare by working and paying their taxes for a minimum required period. Even if you don't work long enough to be entitled, you might still be eligible to enroll. You might just have to pay more. While Medicaid is a state and federal health insurance program, and states establish and administer their own. They determine the type, amount, duration, and scope of services within the broad federal guidelines. They are required to provide mandatory benefits and allow the state to offer optional benefits as well. Who qualifies for each of these programs? Both of these programs do have similarities, but in Medicare, to be eligible, you have to be 65 and older, anyone with kidney failure or long-term kidney disease, and people who are currently disabled, where there is a list of specific disabilities that they have and unable to work. And in Medicaid, to be eligible, you have to be low income, a pregnant woman, children under 19, 65 and older, so that's similar to Medicare, blind, disabled, and anyone in need of nursing care home. What are the benefits of each of these? Medicare is paid for by a trust fund funded with payroll taxes. So during the course of your career, money is taken out of your paychecks that goes towards this trust fund. It's the same program nationwide. It benefits people over the age of 65. Participants pay a deductible and part of their coverage, and it is divided into 4 parts where you're able to actually pick the coverage that you want. Medicaid is a federal and state assistance program. It's paid for by federal, state, and local taxes. It can differ from state to state, where each state can pick what they want to cover and offer any optional programs within that. It benefits people with a low income. Participants pay very little or no part of their coverage at all, and they do receive regular dental and vision exams. These are both similar in that they both benefit people with disabilities. They both have a prescription drug plan, and they have outpatient and inpatient hospital care. What is the cost of each program? With Medicare, it primarily depends on the plan that you choose and how much you've put in over the course of the time within your taxes. The cheapest plan that I was able to see was in Part B, and that was about $134 a month. Medicaid's cheapest is entirely based off of your income, where the cheapest I saw was free, or even something as cheap as a doctor's office copay, or even prescriptions, which was as low as $4. Medicare plans and benefits. There's 4 different options. There's Medicare Part A, where hospital coverage, inpatient care in hospitals, which includes critical access and long-term care hospitals. Part B, which is medical coverage. This is doctor's services and outpatient care when medically necessary. Part C, Medicare Advantage plans. This includes all of Part A and B, as well as extra benefits. And then there's Part D, which is just the prescription drug plan. This is available in standalone plans, or they can add this as part of the other 3, Part A, Part B, or Part C, where you have all the other options available. There are some things that Medicare does not cover, so here's a list of the things. Long-term care, most dental care, eye exams, dentures, cosmetic surgeries of any kind, acupuncture, hearing aids and exams for fittings, and routine foot care. The Medicaid benefits. Mandatory benefits include services like inpatient and outpatient hospital services, and this is the benefits that is just regulated on the federal level. So they're mandated to have inpatient and outpatient hospital services, physician services, laboratory and x-ray services, and home health, among just a couple of the things. Each state does offer an optional benefit. And it can include services like prescription drugs, case management, physical therapy, occupational therapy, and I believe I did see autism services and even hospice services are available. Each state has other optional benefits that they allow. It just is within your guidelines to look in your state and see which one is offered. So this is what we compiled as far as Medicare and Medicaid and the differences, what each plan offers and the cost. Hope you learned something from my presentation. Thank you. Bye.